Hello, everybody, and welcome to day 3 of our annual meeting. I want to say good morning, good afternoon, and good evening, depending on where you are. For those of you who I haven't had the opportunity yet to meet, I am Cindy Gavin, founding executive director of Let's Win Pancreatic Cancer, and it is an honor to serve as the co-chair of the WPCC annual meeting once again. I want to share that on behalf of Diana and I, Diana Jupe could not be here, the other co-chair. She is this evening accepting an award on behalf of her organization in the UK. So congratulations to Diana, and we will miss you today. Once again, our deepest gratitude to our sponsors. We could not do this without you. Thank you, AstraZeneca, Ipsen, Novartis, Novocure, and Merck. Not only have you financially support the WPCC and our mission, but we're grateful that you were able to engage with us throughout the annual meeting and, of course, throughout the World Pancreatic Cancer Campaign. Okay, so let's dive into our recap of the breakout sessions. And just as a reminder, last week we held regional breakout sessions that were held on Zoom. And the intent of those sessions were to really do deep dive conversations into 3 topics that everyone has told us are important to them. While the groups were actually not as well attended as we had hoped or that had registered, the people that did attend, I think, really had a meaningful session, and the feedback has been really extremely positive. So I'm going to start on behalf of Diana, providing a recap with the breakout session that were held in Europe, Mideast, Africa, and Asia Pacific. There were 3 sessions held: diet and nutrition and healthy living, social and emotional health, and palliative care and pain management. I want to give a shout out and a thank you to the speakers who so graciously offered their time and their expertise. So thank you again. Now to dive into diet and nutrition. Let me see if I can get this as a full screen. Excellent. About 10 years ago, when we think about the recommendation for diet and nutrition, patients were really told to go home and rest. And now we know that they need much more. And, a lot of things that present with diet and nutrition are starting with understanding malnutrition related to having pancreatic cancer. And the need for protein is essential. Some of the things that were discussed in the breakout session were around protein being included in every meal, how cachexia is really particularly a problem when it comes to treating the disease. Some of the other things that were talked about were enzymes and PERTs, and studies showing what the impact is having enzymes properly prescribed in one's diet. One of the things that has been noted is just the challenge in maintaining one's weight, either before, if lucky, for surgery or during chemo, and the benefits of just many things, including exercise, to help build muscle, to help keep patients both emotionally and physically strong in order to get the best quality of life. I think many regions have struggled with not enough information to both dietitians, and enzyme replacements that really have a significant impact on a patient's success. As we move into social and emotional health, some of the key highlights that came out of the conversation last week were around the cancer just doesn't affect the person. The caregiver is really a part of the team and really needs as much support. So it's often that, not only is the cancer patient the one that needs the support, but the caregiver as well. Learning to get the right team together to help get the right information, curate your team, learn to manage stress and anxiety during treatment. nutrition, as we discussed, and really being open to the professional support that's available. There's often the conversation overseas was also around the fact, same slide, please, often around the fact that people have goal setting and making memories and getting the most out of, living today with the disease and enjoying your time, a patient's time. And it was noted that globally it varies and practices vary and access to care vary. So I think, my takeaway from being in this section in the Americas is that we really need to share resources because those resources can really be universal. Next slide, please. The third session in the breakouts last week was around palliative care and pain management, and how palliative care deals with holistically approach to the patient. And 85% of patients experience pain, mainly because the pancreas is surrounded by nerves, and that triggers pain for patients, and how to really effectively support the patient through pain management. Essential care and the patient regular check-in about it, and having access to the team if suddenly they're in pain is really important. One of the things that was discussed, I think, over in the session that Diana led was that 55% of patients in the UK died at home versus 26% in hospice and 19% in the hospital. And globally, there are differences where how patients feel about where they die and where they get their care, and how palliative care and pain management is managed throughout the disease. It was noted, of course, that the earlier patients get the support of palliative care, the better that it is for everybody involved. Next slide, please. So I had the privilege of attending 2 of the sessions in the Americas last week, led by Poppy Kosvis, Lauren Schaefer, and Dr. Silva, around diet and nutrition, also social and emotional health, and palliative care and pain management. So I'm sure you would expect that many of the discussions were similar in the Americas when we were in our Zoom session. Again, diet and nutrition, malnutrition contributes really significantly to a downward spiral in disease management and, of course, quality of life. So patients really need to, protect muscle, gain calories, make sure to work with their team to ensure the right diet and proteins. And it was noted with the group that clinicians are really not doing a great job. And, some of it may be because they're just too busy, but patients really need to self-advocate to get the right support that they need, either through enzymes being an important protocol, through other nutritional guidance that they can get from their team. And of course, exercise and physical activity were noted as a key part of healthy living while getting treatment. And the goal is always to just make sure that our patients get the quality of life that they deserve. As we move on to social and emotional health, patients are often very overwhelmed and they don't know how to access the emotional support. We discussed in our session, and I happen to be included in this discussion, this is just not a one-size-fits-all. Patients and families have different level of needs, have different wants around the emotional support, and no 2 patients need the same support. So we discussed sharing resources that we have available. The session that was led in the U.S., the woman, Lauren Schaefer, she actually runs a pilot program at New York Presbyterian where she meets with patients while they are getting their chemo treatments. So it's not a support group. It's just the opportunity to speak to a skilled social worker that specializes in working with oncology patients. And that's a very, very unique opportunity for patients in that region. However, that's not available for everybody, and this is very specific to her institution. So it was discussed that we want to share a variety of online resources that may include one-on-one peer support, caregiver support, in this day and age, maybe Zoom support, but there's many ways that people could access support. So following this meeting, we will be sharing a bunch of links that people can go to see various resources. The other thing that we discussed at length was that the emotional support for caregivers is really, really critical, because they often bear the brunt of carrying the stress and the anxiety of caring for a patient. So the caregiver is equally as important when we talk about the social and emotional health of a patient. One thing that came up is positive and negative was that the pandemic greatly heightened stress around patients. Patients are anxious to get care in light of being exposed to COVID, and the healthcare system has changed. But on the positive side, there is a rise of telehealth, which has increased access to support and to care without leaving your home. Another thing that was discussed in this session was just the cost, and this varies, both throughout the U.S. and it varies globally, how patients can get counsel and the barriers to access, and the needs to make this more available and affordable using resources that may be affordable to patients and families. And then finally, there was a healthy discussion about end of life and the importance of having that conversation. And that could actually be a stress factor for many patients and families. And while it's a scary conversation to have, it's often a very important one to have, and leads to less stress for everybody involved. Next slide on palliative care and pain management. So palliative care and pain management, we had a very long discussion about the difference around what is palliative care and what is hospice, and people being very confused and not understanding that palliative care is not hospice, and introducing it maybe more as supportive care as opposed to palliative care, so there won't be so much confusion. Who's really part of the palliative care team? It's many people. It could be your physician. It could be the nurse. It could be your chaplain. For some people, the emotional support is through spiritual connection, and that's important. And it could be through social workers. And this looks, again, this is not a one size fits all. This looks different depending on your location. Regardless of where you live, this just may be different because of your access to care and the team. But what was noted is that, beyond cancer, there's 40 million people that are in need of palliative care each year, and millions do not receive, and there are not enough trained providers. And this is such an important part of a patient's journey with pancreatic cancer, with cancer, or with other diseases. And it really, I think studies have shown that it really helps people with their quality of life. It helps them fewer visits to an emergency room or hospital visits. So there's really a very strong need to normalize palliative care and get patients access as early as possible. So I just want to, again, thank all the speakers. They really spent an enormous amount of time both preparing and providing their expertise, and really partnering with all of us globally to create these meaningful sessions. So I hope everybody that was able to attend enjoyed them, and we will continue to provide resources as we move forward. Okay, So now I have the honor of helping kick off World Pancreatic Cancer Day, which is coming up in just a few weeks. And I know everybody is excited, as I shared. I hope you've seen the assets that were created. They are really exceptional, and I think that we're going to all get a lot of use out of the great work that's been put into this effort.